Greetings. Let me present this topic on threshold for transfusion in patients presenting with gastrointestinal bleeding. In the past, when I was in training about 30-40 years ago, we used to transfuse patients with the GI bleeding whenever the hemoglobin dropped below 10 grams per deciliter. Now that concept has changed. We transfuse when the hemoglobin drops to below 7 grams per deciliter. This was based on a beautiful study that was published in the New England Journal of Medicine, where they compared restrictive versus liberal strategy for transfusion. Restrictive transfusion strategy when the hemoglobin drops to below 7 grams per deciliter. Liberal transfusion strategy when the hemoglobin drops to below 9 grams per deciliter. So in that comparative study, when you restrict the transfusion to hemoglobin that has fallen below 7 grams per deciliter, what they have shown is it has several benefits. It reduces mortality, rebleeding, transfusion reactions, cardiac events, and length of hospital stay. You may wonder why this benefit. So this is because of lower splanchnic blood flow or pressure with restrictive strategy. And also with restrictive strategy, there is going to be less impairment in coagulation. So these may be the two reasons for this benefit. And this applies to patients who do not have any cardiovascular disease and who are not in shock. So let us talk about when a patient presents with a GI bleeding and is in shock or has hypotension. In that case, you may want to transfuse before the hemoglobin drops to 7 grams per deciliter, as waiting would make the hemoglobin drop much lower than 7 grams per deciliter. So that is something to keep in mind. When somebody comes in severe GI bleeding and hypotension, you don't want to wait. You transfuse promptly. How about patients who have a history of prior cardiovascular disease? In that group, the guidelines suggest that you don't wait to 7 grams. You may start transfusing when the hemoglobin falls to about 8 grams per deciliter. Or in patients who have coronary syndrome, who are hemodynamically stable, you may want to transfuse if they have active symptoms, even when the hemoglobin was above 8 grams per deciliter. So let me summarize. When to transfuse blood products, packed red blood cells in a patient with GI bleeding. If the patient has hypotension, you start transfusing. If the patient doesn't have hypotension, doesn't have history of cardiac disease and no cardiac symptoms, you could transfuse when the hemoglobin drops to below 7 grams per deciliter. When they have pre-existing cardiovascular disease, the threshold is 8 grams of hemoglobin per deciliter, and above 8 grams in patients who have acute coronary syndrome. So I hope this helps you in managing patients, and I would recommend you to read the current guidelines published in the American Journal of Gastro on management of GI bleeding, and also beautiful articles published in the New England Journal of Medicine about the role of restrictive transfusion strategy in patients with GI bleeding. Thank you.